Recently, a new strain of infectious coronavirus called COVID-19 was discovered in Wuhan, China. In the next few months, it rapidly spread to other countries and has quickly become a global pandemic. On the day of making this video, there are more than 2 million confirmed cases and 130,000 deaths worldwide. Coronavirus is a large family of viruses that can cause illnesses ranging from common flu-like symptoms, fever, to respiratory syndrome such as pneumonia, and even organ failure and serious complications. Like COVID-19, SARS, severe acute respiratory syndrome, and MERS, Middle Eastern respiratory syndrome, outbreaks were also different strains of coronaviruses. Now, what really happens if you get infected by COVID-19? What can you do to improve your chances of surviving the disease? A virus is merely just a microscopic structure made around genetic materials called RNA and few proteins, possibly not even a living thing. It can multiply into more of itself by entering a living cell. Coronavirus may spread via surfaces, but it is still unsure how long it can survive on them. It mainly spreads through droplets infection. It occurs when an infected person coughs or sneezes and you come into contact with their droplets. The virus in the droplets can enter your body when you simply rub your nose, eyes or mouth. It starts its journey from your face and uses your throat as a highway to travel deeper into your body. Its final destinations are your stomach, intestines or the lungs, where it can have a substantial effect. Even a small number of coronavirus can have a considerable impact on your body. The interior of the lungs is composed of billions of epithelial cells. These are the surface cells of your body, bordering your organs and mucosa, prone to be infected. The COVID-19 virus attaches to a particular receptor on its victim's membranes to insert its genetic material called RNA. The infected cell, unaware of what's happening, executes the new instructions, which are quite simple. Copy and reproduce. It fills up with an increasing number of copies of the virus until it gets a critical instruction, self-destruct. The cell then breaks down, releasing new COVID-19 viruses prepared to attack more healthy cells. The amount of cell infection grows exponentially. After the incubation period, usually 10 to 14 days, hundreds of thousands of healthy cells are infected, and millions of viruses fill the lungs. You will start to feel the symptoms of the disease by now. However, the COVID-19 virus has not caused a great deal of damage yet, but the effects of infection are going to initiate a real problem on you, your own immune system. Although the purpose of the immune system is to protect you, it can actually be pretty dangerous to yourself and needs serious regulations. And as immune cells get loaded up into your lungs to fight the virus, COVID-19 infects some of them and creates disorientation. Cells do not have a sophisticated communication system. Since they are microscopic particles, their means of communication is mostly via tiny information proteins called cytokines. Almost every important immune response is supervised by them. Corona makes infected immune cells to overreact and activate mass destruction mode. In a way, it puts the immune system into a war zone and demands more soldiers than needed, wasting its resources and causing unnecessary damage to healthy tissues. This may get so dreadful that it may cause irreversible damage that leads to lifelong disorder. In most cases, however, the immune system slowly retrieves control. It then destroys the infected cells, viruses and clears up the lungs. Recovery takes place. Most of the COVID-19 cases will get over it with relatively mild illness. But in severe complications, millions of epithelial cells have been destroyed, and so does the lung's protective lining. This means the tiny air sacs through which breathing occurs, namely alveoli, can undergo bacterial infection that aren't usually a big problem. This causes pneumonia. Respiratory function becomes harder, even fails, and patients should be supported with ventilators to survive. Since the immune system has used up almost all of its resources for weeks to make millions of antiviral weapons, and as the newly activated bacteria rapidly multiplies, it gets overloaded. They enter the bloodstream and swarm up the entire body. As a result, death is highly likely. To survive COVID-19, the most obvious thing to do is not get infected and not infect others. Even though it sounds insignificant, the very best thing you can do is to wash your hands with soap. The COVID-19 virus is covered with a layer of fat. Soap can break that fat apart and inactivate the virus. Also, it makes your hands slippery, and with the mechanical motion of washing hands, the viruses are ripped away from your skin. To make it effective, rub your hands thoroughly with soap for 20 seconds before washing it off. The next thing is social distancing. Although it isn't a nice experience, it is the right thing to do. Avoid handshakes, hugging, and close-range communication with someone. To be more precise, it is suggested that you maintain about 2 meters of distance between the person you are having conversation with. This is because droplets from a sneeze or cough travel about 2 meters in the air before it reaches the ground. Avoid being in a crowded place, as it significantly increases your chances of contracting the virus. If you can, stay at home to protect those who need to be out for society to function. From doctors to police officers or shopkeepers. At global scale, there are quarantines, which mean different things, from restriction of public transport to travel restrictions or actual order to lock down at home. Quarantines are not a great experience and certainly least desirable. But they are important procedures to slow down a pandemic like COVID-19 and bide the researchers working on developing medicines and vaccines pivotal time. So, if you are under quarantine, you should understand why and follow the rules with appreciation. Although none of this is fun to do, and it is inevitable disruption to our daily lives, in the big picture, it is a crucial thing to do to fight this COVID-19 pandemic. In case, if you have contracted the virus, do not panic, as most healthy people can make it through. Make sure you self-isolate yourself at home, and practice good hygiene to prevent spreading the disease to others. Drink warm water as it would help soothing your throat from dry coughs. If your illness is mild, give the virus enough time to run its course, eventually recovery will take place. Eat healthy food as your immune system needs vital nutrients to fight the disease. However, if you have serious symptoms such as breathing difficulties, please seek medical attention as soon as possible. Thanks to WHO for publishing useful information that was helpful in making this video. Thank you for watching. If you like this video, please leave a thumbs up and subscribe for more videos like this.